I'm Chuck Otterson. Welcome to Healthwise. With me today is Dr. Leon Uribe. Welcome to the show, Doc.
Thank you, Chuck. Thank you for having me.
I would like to get right to today's topic, diabetes. Now, diabetes is getting a lot of attention these days. Some people are calling the increase in diabetes cases an epidemic. I guess you can't blame them. Listen to these figures. According to the American Diabetes Association, there are more than 25 million cases of diabetes in the United States at the present time. There were almost 2 million new cases in 2010, and get this, Americans spent $245 billion on diabetes in 2012. That's $245 billion in 1 year. Well, doctor, those figures definitely got my attention. Could you explain just what diabetes is and how do we get it?
Sure. What diabetes is, Chuck, is that your body is not able to deal with the amount of sugar. And what happens is it gets overwhelmed with this amount of sugars, and this extra sugar in the whole body starts damaging the organs and systems. And that's what happens, and that's what diabetes is all about.
Well, you know, I hear a lot about the damage that high blood sugar and low blood sugar can cause, and it's damaging somehow. And what kind of damage does it do, and how does it actually do damage to our internal organs?
Well, what happens is that when these extra sugars are in the body, the cells, the normal cells that we have everywhere, they cannot work properly. So you start having damage in the membrane and the cells start breaking down. So what happens when you get this problem, like in your kidneys, in your liver, your heart, your brain, everywhere, you start the eyes, so all this is not working properly, and that's when you start having the damage. That you lose your vision, your heart is not pumping well, your kidneys are not working well, and this is what causes all the damage and all the morbidity that diabetes brings with.
Oh.
What that causes is that when you have too much sugar in your body starts having problems and it starts having damage to all the organs and systems, because it's kind of overwhelmed with all the amount of bad sugars, and that's what...
Well, all that destruction from sugar, there are many different kinds of sugar. Are any of them easier for or better for a diabetic to ingest than others?
Definitely. The problem you see is with diabetes is that people avoid all sugars. And the reality is that we need sugar. Our body needs sugar. That's how we work, right? So the important part is to understand that the good sugars are the ones that we need to eat more frequently, and the bad sugars we need to avoid. So to answer your question, good sugars are the sugars from fruits, from vegetables, from legumes like beans and lentils. So those are all sugars your body processes in a perfect manner, and they provide the fuel that you need for your body. The bad sugars will be pretty much everything that is processed, you know, like white sugar, bread, pasta, rice, sugary drinks, ice cream, oatmeal, cereal, something that most people think they're good, and they really are damaging, you know, and kind of flooding the body and overwhelming the reaction to these things.
How does honey fit in, doctor? Is it good or bad?
Well, to me, it's not really good or bad. It depends on how much you use, right? Okay. So comparing with white sugar, honey could be better, but if you're doing like half a bottle every day, it's going to cause some of the same damage that you're doing with the regular sugar. So honey, honestly, it's natural. So if it's a good one, you know, from a good source, but if you do too much, it's going to cause kind of the same effects that you can have with regular sugar.
So in other words, if you have 1 spoonful of honey in a cup of tea, for instance, that would be okay. But if you have 3 teaspoons of honey in every cup of tea and you have 5 or 6 cups of tea, you're defeating the purpose of avoiding refined sugar and using honey. You're doing the same damage.
So something that we didn't mention before, Chuck, and is how the whole diabetes problem happens is, like we explained, if you have too much of the wrong sugars, your body cannot process that well.
Right.
It's, you know, think about like a vacuum cleaner. You see that you're using it and it's doing their job, but once the filter gets full of dirt and stuff like that, the machine is trying to work, but it's not really doing it.
Right.
So in our bodies, the pancreas is one of our organs. It makes a substance called insulin, and pretty much all of us have heard about it. You know, most people have heard about insulin because they see people and patients that they use insulin to control the diabetes.
Right.
So this substance, what it does is when your sugar goes high, your body makes the insulin. It goes to the body to decrease those levels of sugar. So what happens if you have too much sugar, you make more insulin, but it gets to a point that it keeps escalating. And then even that you're making the insulin and you're producing it, it's so much sugar that think about that filter full of dirt. So you're making the insulin, but the insulin cannot work. So the sugar keeps going up, and then when you reach certain levels, like, you know, above 400 or 500 or 600, is when your body cannot work that way. Think about it, you know, an overheating engine, it gets to a point that it won't run anymore. And that's when the person can have a problem and crash and have to go to the hospital, you know, and ends up in a diabetic coma or stuff like that.
Here's some other figures here that interest me, and I'm sure might surprise some of our viewers. The Diabetes Association estimates that there are more than 7 million undiagnosed cases of diabetes in the United States. So a lot of people have diabetes and they don't even know it. How would anybody know if they are diabetic? Are there any signs or symptoms that we should be concerned with, and how is it treated?
Definitely there are signs and symptoms, Chuck. And the most important thing that you start noticing changes in the way you normally function. When you start noticing that you're having a lot of thirst, or you're urinating too frequently, or you start having issues that you're craving the sugars, you know, like your body's telling you you need to have more of that. I mean, you used to have 1 or 2 slices of bread. Now you feel like you have to have 3 or 4. Something's changing. So your body will tell you that something's going on. You see, the body is so perfect that it will tell you if something's malaligned, right? Best way to diagnose it will be with a blood test. You know, easiest thing to do is fasting glucose, like the sugar, check it in your blood, and based on those results, the doctor can order something else that will confirm if you have diabetes or not, something like a hemoglobin A1C. It sounds fancy, but it's basically a test that will tell me how your sugars have been running for the last 3 months.
I never thought about our pancreas being like a vacuum cleaner and getting filled with dirt, and oh my God, that doesn't sound like a lot of fun. I know I wouldn't like it. Is there anything that we can do to prevent getting diabetes?
Definitely, it's a lot of things that we can do to prevent diabetes. Like I told you in the beginning, diabetes is not a disease, it's a consequence.
Right.
So if people start eating more of the good sugars and less of the bad ones, you shouldn't have diabetes at all. Definitely, it's a lot of things that we can do to prevent diabetes. Like I told you in the beginning, diabetes is not a disease, it's a consequence.
Right.
So if people start eating more of the good sugars and less of the bad ones, you shouldn't have diabetes at all.
You know, something you mentioned before about thirst kind of hit home with me, because for decades, when I eat in a restaurant, a lot of times when you're waiting for your food, if they bring you bread, I eat a lot of bread. You know, if they bring a hot bread, you know, oh, that's good, and I sit there and waiting for the food, and I eat a lot of bread that I wouldn't ordinarily. If I'm eating at home, I'm not sitting there waiting for the food. As soon as it's ready, you know, I eat it. And also, I keep drinking water. And a waitress said to me many years ago, she says, "Do you have diabetes or something?" Because she kept having to refill my water glass. So that is definitely a sign if you're having excessive thirst. I mean, in my case, every year when I get a physical, they check me for diabetes. I don't have it, but that is a symptom that you might find suspicious if somebody's excessively thirsty then.
Definitely it's a symptom. If you think about it with the bread and the water at the restaurant, that's, you know, if you think about it, bread is all sugar. So you actually keep chewing it and chewing it, it's gonna have a sweet taste. So if you're doing 3 or 4 and you keep doing them, you're gonna be thirsty because your sugar goes right away up. And that's what you need in the water to kind of, you know, ease that sensation down. So that's what happens. You have too much sugar in your body's like kind of dehydrated. That's why you needed that water to kind of dilute a little bit that high levels of sugar. So it's interesting you mentioned that because that's what happens exactly with diabetes. You know, you're having too much bread or you're having too much sugar, too much of this or that we mentioned before, and that's when you start having issues with diabetes.
That's very interesting. You know, I remember when I was a boy, about 10 years old, my grandparents were visiting, and we drove down to Key West, and we're driving through the Keys, and there's a big sign, orange juice, all you can drink, 10 cents. Well, my grandmother was diabetic. So we go in, everybody's ordering orange juice. She says, I can't get it because I'm diabetic. And then she says to my grandfather, she says, why don't you get an extra glass and I'll drink it? It was like she thought if she didn't order it herself, she could drink it, which I thought was very amusing. Anyway, apart from the medical treatments, monitoring sugar levels, insulin shots, and so on, what else can a person do to manage it and minimize the damage?
The best thing that a patient with diabetes can do, Chuck, is to get a doctor that really understands diabetes. Instead of putting on 10,000 different drugs, will help that person to control the way they eat. Okay? One of the things that I tell my patients is that if you change your diet and you start eating properly, you can get cured diabetes in 3 months. And I've done a lot of that with so many patients that decided to follow my advice. So, because once you start getting into the insulin and checking your sugars, and think about, you talk about $245 billion industry. So it is huge the amount of money that we're spending on diabetes when simple things that we're going to talk about a little bit later can do to prevent the problems with diabetes. So if you eat properly, if you exercise properly, like if you take care of your body and take care of your diet, the diabetes will go away.
Wow, that's interesting, because I was going to ask you if there's any hope for a cure, but it sounded like you said you could cure it in 3 months if people are eating properly and avoiding the foods that do the damage?
Definitely, and that's what I've been doing with many of my patients, because even when you go to the American Diabetes Association, they had a little part that says that diabetes is manageable, but it's not curable. The normal, if you're not diabetic, it should be under 6.
Right.
If you're diabetic, like if you're above 6, you're diabetic, and if it's above 7, your diabetes is not controlled. So if we get you under 6, you're cured. And I have a lot of doctors, that I send my patients that they don't have diabetes anymore. And the other doctors say, well, once a diabetic, you're always a diabetic. But think about the implications of this. Think about the labeling with patients. Oh, I'm diabetic, like your grandma, right? Like she couldn't have the orange juice.
Right.
She couldn't have it. You just have a glass and that's it, instead of having the whole, the whole carton or whatever she was doing, right? So there's a cure. Even for patients with diabetes type 1, we haven't talked about that. That's the patient that their pancreas doesn't make the insulin, right? All this we've been talking about is type 2 is when we overwhelm the pancreas. Your pancreas works, but the insulin is not doing the job, right? But even for patients with type 1, that the pancreas doesn't work as good as it should, if you eat the way we're going to talk later, you can control your sugars without insulin. So it's amazing. So it definitely is a cure. I know there's a lot of doctors that don't agree with me on that, but I have the patients to prove it. I have a patient who came to us with 13.8 of hemoglobin A1C is really high, and in 3 months we got him to 5.7. And all he did was to follow the recommendations, and he took it to heart.
I don't know if diabetes runs in my family or what. I mentioned my grandmother, and she had problems with her eyesight. And my uncle, one of my dad's brothers, he's practically blind now. He has diabetes. His wife had diabetes, and she had one leg amputated. Later, she had the other leg amputated. Not long after that, she died. So is that common if you have diabetes, that you'll have eye problems and maybe have to have legs or arms amputated, something like that?
Well, what happens is if you don't control your sugars, remember we talked, that much sugar in your body is
Right.
damaging the cells, and it's damaging like the optic nerve, so you cannot see, starts damaging your nerves and your blood vessels, so you lose blood flow to your extremities, and that's when you get the gangrene, or you get the diabetic foot and all those things. So that will happen if you don't control your sugars. If you take care of your diabetes and you get it well managed and well controlled, those things shouldn't happen. It's a consequence. Again, I like to remind you that, because if you take care of yourself and you take care of your sugars, you shouldn't have any problems with that. So those patients that have those, like legs amputated and they cannot see anymore, they never took care of their diabetes. And most of the time they were doing even insulin and stuff like that, but they just kept eating the same way they were doing. And then the damage is so bad that now, is no reverse on that.
I was amazed. Years ago, I started checking labels on things, and I checked the fat content. It wasn't until much later I started checking the sugar content. So when I started checking the sugar, I was amazed to see something like grape juice or apple juice. Grape juice has something like 40 or 42 grams of sugar in one serving. And I thought, well, that's amazing. That makes it sound like you're better off drinking a cola or something than natural fruit juice. But how does that amount of sugar in fruit compare? I mean, I'm sure if you ate 42 grams of refined sugar, it'd be worse than drinking a glass of grape juice.
Well, it is worse to do the white sugar, but something with juice is that if you ever made on your own, like you squeezed oranges to make a glass of orange juice,
Right.
you need at least 4 or 6 to get a half glass of juice. So you never, or it's pretty hard to eat 6 oranges in a sitting. So when you think about it, orange juice or grape juice or apple juice is just the sugar. You cannot have, 6 apples in one sitting. I mean, some people will, but it's not that fun, right? So to answer your question, it's better to have the juice if it's for real fruit, right?
Right.
But it's even better to have the real fruit, because first of all, you're gonna get that fullness sensation that you don't get with the juice, because you have a glass and you're still not full.
Right.
When you actually chew and enjoy your orange or your apple or your grapes, you're gonna have the same, actually better sweetness, because if you think about it, all these juices have the pasteurization process and the packaging and the processing is not, you really don't have nutrition on it. So what I recommend to drink for my patients is plain water. If you try to do all the water, everything water, and you have your coffee if you like it, and just when you need that, like fruity juice or whatever, have the fruit itself, and you're gonna enjoy it more. And it takes time, because when you're used to just do juice and juice all the time, or sodas, it's not easy to switch.
Right.
But if you want to prevent the damage from diabetes, it's worth the switch.
So you're a lot better off eating an apple or a few grapes than drinking a glass of juice.
Definitely.
Okay. Well, new technologies are allowing doctors to delve deeper into the workings of the human body than ever before. There is always hope for the future. We're just about out of time. Tune in next time for another edition of Healthwise. Thank you for being with us. This is Chuck Otterson for Dr. Leon Uribe, wishing you all goodbye and good health.